My name's Jen, and today Darlene and I are going to talk to you for the next 40 minutes or so about the impact of lifestyle on somebody's cardiovascular health. So I like this topic personally because this is something that you have control over. We know that our lifestyle impacts our cardiovascular health, and that's especially true if you believe the old saying that I grew up on, that you are what you eat. So this saying, I don't know how true it is the way we use it day to day, but it's especially true when it comes to heart health. And that's because 4 of the risk factors that for heart disease actually have a relationship to our diet. And that includes high blood pressure, high cholesterol, diabetes, and obesity. So we can be confident when we make changes in our lifestyle, in our food, in our portion sizes, that we are in fact having an impact on our heart health. So I want to begin with some of the basics. We just said you are what you eat, so obviously what we put in our body impacts our inner health. And this is true when it comes to our cholesterol levels. So cholesterol is basically a waxy substance produced by the body, and we also consume it when we eat animal foods. We can't eliminate cholesterol from our body because we use it for many healthy things, including the production of vitamin D, to keep our skin healthy, to make different hormones. So we need cholesterol. As you well know by that now, you have good and you have bad cholesterol in your body. The good cholesterol, known as HDL, or you can remember that by healthy cholesterol, basically acts like a scavenger, and it goes through the body and it picks up extra cholesterol in the blood. It takes that cholesterol to your liver, it's processed, and then it's eliminated from the body. So you want more of these scavengers in your body, or you want more HDL. The LDL is the lousy or the bad cholesterol, and that basically takes cholesterol and takes it to your organs and takes it to your tissues. If there's excess amounts, it can build up under the blood vessel lining, and that's what we call plaque. You build up too much plaque, obviously your vessel's narrow, and that leads to problems in your cardiovascular health. So you don't want a lot of this lousy or LDL cholesterol. Triglycerides are a type of fat in our blood, and they basically are the way that our body stores extra calories. So if you often eat more than you burn off, you're probably going to have higher triglyceride levels. And that's especially true if the extra calories you eat are in the form of refined carbohydrates, in the form of alcohol calories, or in the form of fats. Now, how much of these substances should we have in our blood? It looks like most of us here are over 21 years old, so our cholesterol levels should be between 100 and 199. The HDL, again, the healthy cholesterol, for all the men here, you want your HDL above 45. For the women, you want it above 55. And it would be perfect if all of us could keep our HDL up above 60, because when your HDL, or your healthy cholesterol, is above 60, it actually is known to reduce your risk for heart disease. And your LDL, most of us, our goal is to keep the LDL below 130. However, if you are a high-risk patient, that would include if you have diabetes or if you have multiple risk factors for developing heart disease, which I believe the previous physician mentioned and Darlene might be speaking about, then your LDL goal is to keep your levels below 100. Now, the targets get even tighter if you already have been diagnosed with heart or blood vessel disease, or if you're considered a very high-risk patient, then your goal for your LDL levels is to keep them below 70. So what group you fall in, I don't know. You should probably have a discussion with your primary doctor and say, well, am I an at-risk or a very high-risk patient? So you can look at what your targets are and where your present LDL levels are hanging at. Triglycerides across the board for all of us, we want to keep those levels below 150. So this slide I particularly like because we know that our triglycerides, our LDL levels impact our risk for heart disease, but this slide shows the impact of lifestyle on our risk for heart disease. And Professor Eric Rim from the Harvard Public School of Health was quoted saying that Americans' risk for coronary heart disease can be cut by more than 80% by adopting 5 lifestyle factors. And those 5 lifestyle factors include not smoking, maintaining a healthy diet, maintaining a healthy body weight, participating in regular physical activity, and keeping alcohol consumption to a light to moderate level. So what this chart shows is basically the relative risk of heart disease in U.S. men depending on how many of those 5 lifestyle factors that they employ. And so you can see that a man who performs all 5 of those healthy lifestyle factors is about 80% less likely to develop heart disease than a man who doesn't employ any of those in his lifestyle. So that's exciting news that our actions can affect our risk for heart disease. However, what I find even better is that someone who employs none of these and decides that he's going to make changes, if he adopts one of these healthy lifestyle factors, this chart shows that he can reduce his risk for developing heart disease by more than 50%. Okay, so maybe you're not in a great spot today, but you can improve where you're going by even just adopting one of those 5 lifestyle factors. So again, those are the 5 lifestyle factors, and today Darlene and I are talking about 2 of those. So as a dietitian, it's obviously my job to talk about the healthy diet part. And a healthy diet can take on many definitions. But for today's purposes, we're going to talk about how our diet can be made more healthful to reduce our cholesterol levels, to reduce our triglyceride levels. So I'd like to start by talking about fat in the diet. Right now, the American Heart Association recommends that about 25 to 35% of our calories come from fat. However, there's a lot of discussion surrounding, is it not really the amount, but more of the type of fat that we consume that our focus should be on. So I'd like to look right now at the types. On this screen, you can see there's 2 types listed, saturated fat and trans fat, and those are what we would term in everyday language or bad fats, okay? So saturated fat, I should say a diet high in saturated fat is definitely linked with heart disease, and that's because saturated fat raises that bad cholesterol, that LDL cholesterol. In the Nurses' Health Study, which had about 80,000 women participating, they found that the women that had the highest amounts of saturated fat in their diet automatically had a 16% higher risk of developing heart disease. But where do we get these fats from? Well, meat is a main culprit. And when I say meat, I obviously mean high-fat meat. So if you eat marbled steaks or you buy ground beef and it's in the category of 80-20, 70-30, 85-15, those are high in saturated fats. A lot of our processed meat, so bologna, salami, kielbasa, hot dogs, sausage, and bacon are high in saturated fat. High-fat dairy products, so this includes regular cheese, okay? If you eat American cheese, provolone cheese, Munster cheese, it has a high saturated fat content in addition to high-fat milk, so whole milk, and even 2% milk, to tell you the truth. The tropical oils, which are known as coconut oil and palm oil, also have a high saturated fat content. So how much saturated fat should we really be consuming? The American Heart Association states that we should be keeping our saturated fat intake to less than 7% of our total calories for the day. So even as a dietitian, that doesn't mean a lot to me, 7% of my calories, unless I put it in terms of grams. So up here I've put 2 calorie levels for you. You know, most women, I think 1,500 calories a day, we're in the ballpark of there. So our saturated fat intake should be about 11 grams of saturated fat or less per day. For men at 2,000 calorie intake per day, you would consume 15 grams of saturated fat or less. So with that said, I've also listed some, common foods in the American diet and the saturated fat content. So you can see a tablespoon of butter provides 7 grams of saturated fat. So standing alone, 7 grams doesn't sound that bad, but when you look at it in relation to a woman, I'm supposed to consume 11 grams or less per day. That's a significant portion of my saturated fat. So butter is probably not the best thing to include in my diet. Even 2% milk. A lot of us were proud that we made the change from whole milk to 2% milk, which is a good change, but you still need to realize that a cup of 2% milk provides 3 grams of saturated fat per cup. So it's easy to see how these numbers can add up through the day. Trans fat is the other bad fat, and it is bad because it raises your bad cholesterol while at the same time lowering the good. Okay, it's hard enough to keep those good levels up. You don't need something pulling them back down again. Okay, so trans fat is basically created through a process called hydrogenation, where they take a healthy fat, they try to make it shelf stable, and hence the fat becomes unhealthy. So you can find trans fat concentrated in commercial baked goods, a lot of snack foods, including crackers, chips. Fried foods definitely have trans fat in them. There's no way around that. And a lot of your stick margarines have trans fat in them. So the guideline is to basically try to avoid all trans fat if possible, okay? So when you're looking at labels, you want that to say a big 0 for the trans fat. And again, going back to that nurses' health study that I mentioned before, they found in those 80,000 women that those who had the highest trans fat intake were actually at almost a 30% increased risk for heart disease. Whoops, I'm slides already. So here we have the good fats, okay? We just looked at the bad, here are the good. And the good, we use the term unsaturated, and we group them into 2 categories, which is polyunsaturated and monounsaturated. So the polyunsaturated fats can lower your LDL levels when you take some of the saturated fat out of your diet and you substitute in polyunsaturated fats. The main sources of this in our diet include vegetable oils, including corn and safflower oil and soybean oil. A lot of our fatty fish are rich in these fats, along with walnuts and flaxseed. The monounsaturated are your best source of dietary fat, and that includes your olive oil and your canola oil, along with peanut oil and sesame oil, most of your nuts and seeds, and your avocados. So the whole purpose of this, that's a lot of information about different fats, and it can kind of get a little info heavy. But the main thing that you want to take home is understanding what sources of fat are better for you than the others. And then you want to look at your sources of fat in your diet, and if they are more saturated or trans, eliminating them and substituting in some of these healthy fats in their place. Before we go on to the next slide and look at practical ways to do that, I wanted to just throw in a mention about weight control, because we did, when we were looking at that red graph, and one of those 5 lifestyle factors was maintaining a healthy weight. And no matter if you're eating a good fat or a bad fat, the calories in that fat are the same. So all fat has 9 calories per gram. So really, you want to take out the bad and put in the good. You don't want to leave the bad there and then just put the good on top of it, because that's going to lead to weight gain. And you also don't want to abuse your use of the good fats, okay? A lot of people say, oh, olive oil, okay, I can use as much as I want. Oh, walnuts, almonds, they're healthy for me. I can eat as much as I want. They are good for your heart, but they still have calories, and they're still fairly dense in calories, so you still want to watch your portion. So let's look at some practical ways to improve our fat choices. I'm sure you have good ideas, but these are some that just came to my mind. So choosing lean meats automatically comes to mind, okay? Especially your processed meats. Get rid of that bologna, that salami, the pepperoni, and put in the leaner choices. A lean roast beef, a baked or a boiled ham, a turkey breast would be leaner choices. You can have beef and you can have pork on a heart-healthy diet, but you want to make sure you're choosing the lean cut. So usually if it's a loin cut or a round cut, those are going to be your leaner choices. Fatty fish, or even just fish in general, is a leaner protein. So try to get 2 servings in a week of fish. And again, when it comes to fish or pork or beef or chicken, a serving is usually 3 ounces. So again, that's the size of your palm or the size of a deck of cards. Just because it's salmon and it's healthy doesn't mean you want to eat an 8 to 12 ounce portion. You can improve your fat profile by obviously switching to 1% or skim milk and keeping your cheeses reduced fat. Using a tub margarine in place of butter. When you buy that tub margarine, just make sure it has 0 trans fat in it. Using oil and vinegar on your salad in place of ranch, French, blue cheese, Thousand Island. Just again, watch how much oil you are putting on the salad. Mayonnaise. Mayonnaise is usually in that polyunsaturated group because it's made with soybean oil, but you can even do better by buying the mayonnaises out there that are made with canola oil or olive oil. There's a few of these here. I'm not going to read through them all. You have them on your handouts. You can dip vegetables in hummus or dip vegetables in a vinaigrette dressing rather than a sour cream-based dip or a mayonnaise-based dip. Or try sprinkling your salads with seeds or nuts instead of cheese. And that can be a way to just incorporate more of these healthy fats in place of some of that saturated fat. All right, so we can't avoid the food label, okay? Those are practical ways to improve your fat profile in your diet, but you need to know how to use the label when you're shopping too. So obviously you need to look at the serving size. The serving size tells you how much food, gives you all that good stuff, okay? But the serving size is also important when you're comparing 2 products. You need to make sure you're comparing apples to apples so that the serving sizes are somewhat similar. As far as total fat goes, I don't have a lot of my patients look at the total fat content of their food. You can keep in mind that 3 grams per serving is considered low fat, but again, looking at the type of fat, I would rather you focus on where that total fat comes from. Is it saturated or unsaturated? So when it comes to saturated fat, you need to know, again, how many grams per day you should be having. And for today's purposes, we said women 11 grams or less, men 15 grams or less. So then you can look at your bag of food or your box of food and look at how many grams are there of saturated fat and compare it to that recommended amount I just gave you. Trans fat, you definitely want it to be 0, okay? You don't need any of that in the diet. Now, sodium is something I haven't mentioned yet, so I wanted to take this instance to talk about sodium. Sodium affects heart disease because it impacts blood pressure. And right now, they say the average American consumes about 3,200 milligrams of sodium a day. I think that's a lowball estimate. But the recommendation is we should all be consuming less than 2,300 milligrams. And if you have diabetes or high blood pressure, you should actually be consuming 1,500 milligrams or less. We don't want that. Well, it's not giving me the option to delay that restart. So anyhow, I will move on and let the computer gentleman take care of that. But as a rule of thumb, I tell my patients that if you're following 2,300 milligrams a day, you can use a rule of thumb that if that food's an entree, keep it under 600 milligrams. If it's a side dish, keep it under 250 milligrams of sodium. Again, not American Heart Association guideline, just a rule of thumb to follow. But the only way you can truly monitor your sodium intake is to read labels. I could give you a list of high versus low foods, but that doesn't cut the cake. You need to really just start looking at labels and know what your daily total should be and use what's on the label as a comparison. I like to use something called the 5-20 rule when I'm teaching my patients. This is a quick tool you can use when you're going through the grocery store. And the 5-20 rule corresponds to the percent daily values on the far side of the label. So if a food has 5% of a nutrient, it's considered low in that nutrient. If it has closer to 20% of a nutrient, it's considered high in that nutrient. So for things that have a negative impact on our health, like sodium or saturated fat, we want the percentage to be closer to 5 or less. If it's something that has a positive impact on our health, like fiber or iron or calcium, it would be good if they were closer to 20% of the daily value. So again, that's just a quick and dirty tool that you can use when you're shopping, and you can also use it to compare two food products. I don't know if it's going to let me move on. No, it is not. So I am going, the computer's not letting me move forward in the slideshow. So what I'm going to just do restart now? Okay. That's true. That's a good point. All right. It's going to restart. I'm going to keep moving on, and there are copies of the slides outside, so you can play catch up if you didn't grab one of those as needed already. So the next thing I'd like to talk about is fiber. We talked about fat. We know watching our fat impacts our heart health. The other thing is fiber. So dietary fiber is just the name for a carbohydrate that our bodies don't digest, and it's generally found in our plant-based foods. But there are numerous studies that show that a high fiber intake definitely has a positive impact on cardiovascular health. So how does it impact us? Well, it acts as a binding agent. Fiber basically binds to cholesterol in your intestinal tract so that that cholesterol is then eliminated from your body rather than entering back into your circulation. It's specifically the soluble fiber that plays this role, and good sources of soluble fiber are oats. That's why you see the heart on the Cheerio box or on the oatmeal container. So oats are a good source of soluble fiber, citrus fruits, apples, legumes, and beans. So, if you're trying to lower your cholesterol via diet, put more of those into your daily intake. However, the research shows that it's your total fiber intake, and by total, I mean soluble plus insoluble, that actually has the beneficial effect on cardiovascular health. And when you're looking at a label, that's what it usually tells you is the total. So you can use that number, choosing high fiber foods to have a positive effect on your cardiovascular health. Fiber also helps our heart health by aiding in weight control. If you look at a lot of the commercial diet plans, they really focus on high fiber foods. That's because when we eat high fiber foods, we get full quicker and we stay full longer. So therefore we eat less and we lose weight. The other effect is that if we're really trying to choose high fiber foods in our diet, they tend to be lower in calories. So if I'm trying to eat high fiber, I might say, well, I'm going to choose this apple that has 4 or 5 grams of fiber and only 60 to 90 calories instead of this granola bar that's low in fiber but offers me 140 to 180 calories. So usually, if we're choosing high fiber foods, they usually are less calorically dense, which is another way they help with heart health in terms of helping us maintain a healthy body weight. So when it comes to fiber, it's a kind of popular right now in the food industry, and they're adding fiber to everything. I mean, you can buy ice cream with fiber in it. So you're going to see stamps on the front of packages that say high fiber, good source of fiber. And basically a good source of fiber is 2.5 grams to 4.9 grams. And high fiber, by definition, is over 5 grams of fiber. So I tell my patients, when you're reading food labels, you want at least 3 grams of fiber per serving. That's what I consider fair. That's what the government considers good source. But if it's bread or cereal or even some granola bars, you can do better, and you want to shoot for that high source of fiber, which is 5 grams or more. All right, I don't know if I can do this now. Oh, they're sending someone. Okay. So how much fiber do you need personally? Well, men, okay, if you're under 50, you need 38 grams per day. Men, if you're over 50, about 30 grams per day. Women under 50, 25 grams of fiber per day. And if you're over 50, 21 grams per day. Again, you can always use the guideline put out by the USDA, which is to choose natural sources of fiber. And you can do that by keeping your fruit to about 2 cups per day, vegetables to 2.5 cups, and then making sure you're choosing whole grains. Everybody always asks, well, what about my Metamucil? What about my fiber supplement? Does that count? Yes, it counts. So that if you can't reach your fiber intake goal by choosing foods, you can implement a fiber supplement. My only word of caution is that some of the fiber supplements can interact with certain medications. So just make sure your physician knows you are taking a fiber supplement. If you plan on starting one, then I would just run it by your physician or by your pharmacist to see if there's any interactions that could occur. All right, the next slide that I had and is in your packet is just a list of foods and their fiber content. And I put that in there because it was even amazing to me when I really looked at it, how we can eat natural foods, fruits and vegetables, beans and whole grains, and really reach that 25 to 35 grams of fiber per day. So you'll have that in your slideshow to see some of the higher fiber foods that a lot of us can easily incorporate into our diet on a daily basis. Excellent, thank you. All right, another substance or food item that you can use to reduce your cholesterol are plant sterols. And basically, plant sterols are naturally occurring compounds that are in plant membranes, and we eat little bits of them when we eat fruit and vegetables. However, we have found that if we consume 2 grams of these plant sterols on a daily basis, we can reduce our total cholesterol by up to 10%, and our LDL cholesterol can be reduced by about 14%. So how do we do this exactly? Well, again, you're getting small amounts in your fruits and vegetables, but a lot of food companies have taken these natural substances and they've put them into items that wouldn't necessarily contain these. The most common food product that these are added to are tub margarines. So you may have seen Take Control, Benecol, Promise Active. They usually offer somewhere between 1 gram to 1.5 grams of plant sterols per tablespoon. There's some milks that have these added to them, and I'd like to point out the Pittsburgh Giant Eagle fat-free milk with the Kelly green cap does have plant sterols added to it. So the research definitely is there showing that this does in fact lower cholesterol, and I find it to be an easy thing to implement to your already healthy diet as a way to lower your cholesterol.